Stem cell therapy in the management of joint osteoarthritis and generalized joint pain is a new upcoming field. It's been present for a few years now and is starting to revolutionize the management of joint pain and arthritic conditions. So the procedure is performed usually under a short general anesthetic where the bone marrow aspirate is taken from your hip, or sometimes fat cells are used. These are then processed and prepared to form a mesenchymal stem cell concentrate, which is injected back into the affected joint. The whole process roughly takes about an hour and a half to do, and it's only a day case procedure, so you're in the hospital just for a few hours before you can get on with your activities. This therapy can control inflammation and help healing of the affected tissues and joint surfaces, hence delaying the need for further invasive procedures such as joint replacement surgery. So here at our Regenerative Therapy Centre, we use stem cell therapy to treat and manage mild to moderate osteoarthritis of the hip, knee, foot and ankle and shoulder regions. We also use it in management of chronic conditions such as tendinitis and rotator cuff tears in the shoulder. So stem cell therapy is suitable in a number of patients, either if you've got localized joint lining cartilage defects or cartilage injuries, and also with people suffering from mild to moderate arthritis with joint pain, stiffness and loss of function. So if you have any further questions regarding this or need any more information or want to find out if you're suitable for stem cell therapy, please contact us either by phone or by email and we'll get back to you regarding this.